Hello and welcome to another episode of Behavioral Health Champions, where we talk with members of the legislature and other leaders about how to prioritize healthcare in California, how to make it a true parity issue across the entire state. I'm Kevin Riggs on behalf of the Behavioral Health Champions Behavioral Health Action Coalition, which is designed to really reduce stigma in California and also to increase priority attention to the issue of behavioral health care. And we are fortunate today to be joined at the Capitol by Assemblymember Jim Frazier of the 11th Assembly District. Thanks for being with us.
Thank you.
Your district represents Solano and parts of Sacramento County and parts of Contra Costa County. Yeah. Absolutely. So thanks for being here with us today.
My pleasure.
Let's start with your background. You were a small business owner before you got into the political realm. Give us a sense for what got you motivated initially to get into public life. I know there was a personal tragedy that you went through. Can we talk about that?
Yeah, my oldest daughter was killed in a car accident in the year 2000. My little girl Lindsay was also in the car. And
this is on Highway 50.
Highway 50 up close to Kybers, Ice House Road. And after kind of got things reeled in for Lindsay and get her rehabilitation done, I started asking why. Why did this happen to me? Why did it happen to my family? And found out that there had been, after doing some research, 143 accidents in 14 years and a lot of fatalities and serious injuries on this little 2.5 mile stretch of road. So I hired a highway safety engineer, had an analysis done, and then approached.
And did you know what you were doing at this point, or were you just making it up as you went?
I was winging it. I was just a general contractor who worked for a living and was trying to, raise a family and live the American dream, really. And when I submitted this safety analysis to Caltrans, we were able to work to a solution to change the road. And after we had changed the road, and the road was actually named after my daughter, the Stephanie Marie Frazier Memorial Highway, we noticed a significant drop, significant zero fatality or injury rate. And so seeing that we were, myself and my family were fairly successful in getting something done and accomplished, it kind of gave me some kind of incentive to kind of get civically involved. And I got on the planning commission, then the city council, became the mayor, and then ultimately here I am in the California State Assembly.
So you took your grief and you channeled it in this direction, and it changed your whole career path.
Absolutely, yeah. It was something that just, right now it's the best job I've ever had. I mean, I get to help people every day. Before, when I was a contractor, I could write a check, but it didn't mean anything to me. And so now I actually get up every day and say, how can I be more effective helping people?
So since you have come to the state capitol in 2012, what are some of the kind of the favorite issues that you focus on primarily?
Well, I mean, I am the chair of the Transportation Committee, so transportation in California is one of my passions. And I think after Stephanie's death, that kind of led me to this because I care about highway safety and being a contractor. I get the dynamic. But also, my other passion is helping the IDD population, the special needs. I've been with the Special Olympics for 16 years as a volunteer. And I just love being able to network with the population and look at how I can be more helpful in their path.
When Arnold Schwarzenegger was governor, he was fairly involved with Special Olympics. He used to do a lot of events for them. So it's something that you feel like you make a difference in?
Oh, yeah. I mean, we actually have Special Olympic interns in our offices. And so they're here. We integrate them into our world, and they've been a fantastic it's been a fantastic opportunity to have them here. And we are able to recommend them for jobs once they leave here. And some have been very successful. It's just really fun.
So developmental disability issues, that's been a real passion.
Oh yeah, I'm the chairman of the select committee also of the Intellectual and Developmentally Disabled in California. So I've done hearings from San Diego, 8 hearings, matter of fact, from San Diego to Redding, listening to the population and how we can better serve them.
And Mental Health Caucus as well?
Mental Health Caucus, Senator Jim Bell is our leader, and understanding, because there is a dual diagnosis component also with the IDD population that's been recognized lately. But me in my capacity as a former business owner, understanding that that we're not doing enough. After the demise of the mental hospitals in the 80s, and real no effort from that point on, and you see what a lot of our homeless population is attributable to. And so I'm looking forward to working with the senator and my colleagues and stepping that up too.
You feel as though a lot of the mentally ill have been mislabeled or misdiagnosed by the public when they see them?
I think that there's a big judgment that takes place. There's many different dynamics of mental health. Substance abuse, chronic addiction, you name it, it's there. But what we have to do is we have to build a better mousetrap. We have to be able to make a commitment and get the brightest minds to put together from A to Z how to transform this population of people that have been underserved, really underserved. And it's a crime. It's really criminal. If it was more impactful to you or me, we'd be more up in arms about it, right? And all the public as a whole. But they deserve our best also. They really do. And so, if we were able to make a plan, and then I'll be honest, we have to find the funding for it. I think, and how the funding is prescribed, it has to be in an expenditure plan. I don't think Prop 63 was refined enough. I think you go out and you spread a bunch of money around and have an expectation that things are going to work. That doesn't work well. But if you have a prescriptive plan and implement it, I think that's what we need to do, go forward.
Let's bring this directly to the discussion of Behavioral Health Action Coalition that we're working for. As you know, there seems to be this system, not just in California, but we see a system where people with behavioral health disorders, they're diagnosed and they're treated in much a different way than folks who have a actual physical health disorder or disease of some kind. What's the problem with having these two separate systems, and what should be done about it?
So I agree that they are treated separately. I think that the mental health component should be treated just as much as cancer. It is a terminal disease and can be as impactful. I think that we need to prioritize and identify that there is a population of people that need the help that we're talking about from experts to go through. My daughter is a clinical psychologist in Sharp Memorial Hospital in San Diego, and she's telling me about how their programs are underfunded and they don't get the referrals from the docs, the medical docs. I think we need to be more open about caring about the population and saying that, hey, you need help. And you need the earlier we help people, the better off the outcome. If you let it fester, it's going to be harder to fix, just like anything else.
So preventive and proactive.
Yeah, and I think it starts in schools. I really think that we should increase. We're thinking about doing maybe legislation on required curriculum that actually shares with children this is what is a warning sign in some kind of health capacity. And I think that we need to get back to that and say here are some warning signs, so that at least they can say, yeah, I identify with that, and I need help.
Is that especially timely, do you think, especially in light of reports we read that the instance of mental health issues, behavioral health issues in schools has risen, that there's more cases of kids contemplating suicide than ever before? When you hear about that, what disturbs you, and how does that enter into this discussion?
Well, basically, we don't have the school psychologist anymore. They're really relegated to the IDD population through the special needs. The counselors that you and I used to have in school, now we're for college path, or guidance counselors for college. Those tweeners who aren't getting any kind of help whatsoever, those are the ones that we need to capture and re-engage about how we can better serve them. Because we have an expectation when we send them to school That's just a learning institution. That's not correct. It's a holistic, whole health situation, and their mental health is just important as their education.
So would you say that by and large we're on the wrong track in California when it comes to taking care of people with these issues?
I don't think there's been a vocal enough voice. I don't know that we're on the wrong track, but I don't think it's been prioritized as an issue. I mean, if you look at all of the different priorities that California has, I mean, it should be elevated, to a very important level. But I think that, as you know, the more vocal you are in the legislature or with support from associations, the better off you are. And it starts with lobbying up here with the offices and making sure that they know that it has legs, that it can get done. And obviously, if you can provide an outcome with an effort, then people are really satisfied.
As of the first of this year, we have a new governor. He's been focused a lot lately on other things such as power blackouts and wildfires and more immediate things. But he has talked about making behavioral health more of a priority. As you know, he appointed a czar to be his key advisor on these issues. Are you encouraged by that? Do you think he can follow through on commitment and finding support for making behavioral health issues a bigger priority?
One thing I've been impressed about with Governor Newsom is his willingness to listen. He brings in people that he believes can help him make decisions. And I think that given the right kind of advice, the right kind of plan, if it shows a prescriptive plan, an expenditure that would provide outcomes to the bottom line, then I think that but nobody's done that yet. So I think if you give him the options, that this can be a help. I mean, you can't let him figure it out himself. I mean, we need experts. We have really bright minds in the UCs that should be engaged in to bring these forward. But bringing him a plan would be essential.
But as you say, it has to become a budget item as well. You have to figure out how to pay for it. And granted, we do have a large rainy day fund. There are economic storm clouds forecast for next year. Realistically, what's going to be the challenge in trying to get him to focus on and commit to real money to deal with this issue?
So, again, if there's an outcome that actually saves the state money when you look at the investment, that's one of the things that would be very, very clear to be able to invest in. We have been deficient in funding the IDD population. We got the rate study last year. It's $2.2 billion underfunded. Everything takes revenue. You have to be able to find the revenue. Rainy day fund, you have this impending supposed recession coming up. I would say that hopefully we'll be able to weather the storm, but that's intended use is for that. You have to be prescriptive. You have to find a source of revenue. Prop 63 was supposed to be like the 1.0 to be able to start that path. Unfortunately, I think in my own way of thinking is that it should have had an expenditure plan where it was very prescriptively spent. Okay, there's counties that are sitting on millions and millions of dollars that they haven't spent yet, and they spread it out very thinly. And so maybe in our housing elements, on our arena numbers, we may have to have some kind of management plan for homelessness, which would address a portion of the mental health capacity.
So you mentioned the housing issue, you mentioned possibly adding it to the education curriculum. Any other ideas for legislation that deal with this next year?
It all comes down to revenue. It really does. I've toured some mental health facilities in Vallejo, and they do really well. We don't have capacity either. We don't have the beds. I think in Solano County, a portion of my district, there's not one ability for pediatric crisis care. Okay, so I think that we really need to make a better plan. What are the deficiencies? Whiteboard it and start going forward. But it's going to take a village. It just can't be. It has to have some kind of momentum. I can be a champion for the IDD population. We can move the needle a little bit, but we really, really need a vocal voice that is in unison up here in Sacramento.
And the Behavioral Health Action Coalition that we talked about earlier, a coalition of more than 50 organizations and stakeholders across the state, and this is, of course, their mission is to try and raise attention to the issue and create a greater priority for it. What do you think the coalition could do to work with you specifically to help in this regard?
Well, gather as many individuals as possible that have credible information on how we can move that needle, where we can be effective. And I think that it just needs to be a plan over a period of time. Rome wasn't built in a day and we didn't get here overnight, but we need to have a methodical plan. And if people put their heads together and say, I'll take and attack this issue and you take that issue, and we assign it to legislators and they own it and they believe in it with passion, then I think that we could be effective together.
And what's interesting is a lot of people, more people than you think, are affected by this. Everybody has a family member or a friend or a coworker who's been through some kind of a terrible behavioral health issue. I don't know if you have personally in your own family, but certainly a lot of folks here in the Capitol have experienced that, and even Governor Newsom has talked about that. And how does that enter into the interest in this issue, do you think?
And I think just like my passion for the IDE population, your personal issues or how it's affected you should drive your ability to get things done, right? I firmly believe I'm from the private sector, so I want to make sure that if I'm putting myself forward, that I'm effective. Using family members as an example, removing the stigma, and also how they can be helped or how they were helped is essential. But again, it's an investment. You have to make that investment not only from your heart, but also your time, and then ultimately from Sacramento, the capital, to get it done. I had an uncle that was in Vietnam, and it messed him up horribly, and he ended up dying from Agent Orange. But I remember talking to him, and it he really needed help at that time, and he felt lost and hopeless.
Disconnected.
Yeah, and so, you think about all of our police officers who go through all this trauma all the time, the ambulance drivers, public safety as a whole. They have peer help, but they have an impact also mentally of seeing the things that they do on a daily basis. The people that have schizophrenia or bipolar, and dealing and trying to work or trying just to manage day to day. I think you look within and you say, I may have it pretty good, but it's unfortunate that they don't. What can I do to help them get it and do it better? And I think that's something that we all have to look at.
Are you hopeful?
I am. I've seen different kinds of movements up here, but last year, as the chairman of the IDD Select Committee, I saw a willingness of this administration to move the needle and support. And also the governor has been very vocal about going out and being part of this solution. And I think he cares. I think he really cares. And I think that's one of the things that are important is, as the leader of the state, if he shows he cares, I think there's a willingness to follow.
Assemblyman Jim Frazier, thank you for the time.
I appreciate you. Thank you.
You bet.